I gave up my lacrosse career to become a doctor. At 16, really did a program called Doctors of Tomorrow, and I worked with an orthopedic surgeon, and the rest was history. I went to medical school, in a 6-year medical program and never looked back, and it's now been 41 years since I graduated med school, and I couldn't think of a better choice that I could have made. Mentorship was probably the most important thing for my career development as I went on. And then I think always being humble enough to learn from your colleagues as you go. And I think most of us, even as you get to where I am, if you continue to keep learning from your colleagues that are around you, whether it's your CFO, whether it's your colleague, that's really the trick to becoming the best that you can be. As it has been for Dr. Estes this last year, it's everything COVID, right? So that goes without saying that we have to get of and beyond that. But then what are some of the essential elements that we see going forward? And I kind of look at the world in BC, DC, and AC, before COVID, during COVID, and after COVID. What's really going to be the state of the health systems as we exit COVID? And are we going to be financially in a condition where we can do some of the things that we were worrying about before COVID? The second is rural health care, which almost goes with the first, because if health and hospitals have been adversely affected by COVID, rural hospitals, it's tenfold. And then the third area is about the doctors. I think that's a big part of who we are. About 30 to 40% of the doctors in the United States are employed through hospitals and AHA. So we really want to make sure that they feel they're part of our partnership as we move forward. For healthcare leaders, I always say this is our finest hour. This is the time when the country needs us the most. And I just saw a recent study that showed that the number of medical school applicants has gone up, and they're calling it the Fauci effect. But if you want to look at symbols and people that really reflect who we are as Americans, and I think those of us in healthcare have been given the honor to lead the country through what we're going through now. And it's tough, and it couldn't be any more challenging, but it couldn't be any more rewarding. So as all of us have gone through COVID, we've also recognized that there's going to be some things that we're really excited about that we can innovate. And some of those are the virtualization of healthcare. The second, and one of the areas that the AHA has been very interested in, is all around data. So how do we get together and start to use data for the things? And we've seen during COVID how important data is in predicting whether patients are going to get sick, who's sick, or how do we advance the science of taking care of COVID. So I would say data follows right along with virtualization. And then the third one that's really interesting is just the whole digitization of healthcare. So we were on a digital process that's gotten accelerated. And how do we get care where the consumer or patient wants it, when they want it, and how they want it? I want the membership of AHA to know how accessible I want to be for them. And I want this to be a real dialogue as we go forward and as we problem solve together. And I think one of the most rewarding times for me is really to be with some of the members out there, understanding what their issues are, and then figuring out how we solve them together.